What kind of preparation is needed for hip replacement surgery in terms of medications, testing, moving furniture at home? Because when you are back at home, maybe you have to keep in mind that you will have to make some adjustments.
The first thing is the medication. Usually the medication that you take, it's okay, you have to continue it because it's the underlying conditions that you have to keep managing. The only case is when you use blood thinners, anticoagulants. So depending on which type you use, sometimes we have to discontinue them for 2 days up to 5 days. Well, it's depending on the medication and why it's prescribed for. But again, usually 2 days. After that, we continue them and everything's okay. Other medications, except those that are used for rheumatoid arthritis, so they are different, and we have to check if it's safe to continue them or we have to stop them because of the increased risk of infection. So, but again, it's individual.
But doctor, who is responsible for managing this medication situation? So the person comes to, I don't know, his general practitioner. He says that you need a consult with ortho, then a surgery. So who's the one to explain how this works?
So general practitioner would not do it. It's the main thing is that the GP would give the information to the clinic or to the surgeon.
Okay.
And not to forget that this disease and those medications are, well, relevant. So this is the main thing. Afterwards, we will see, we will ask, and there's a questionnaire that you fill out. And if we see if there's a question marks, so we take a closer look at it and we solve.
Okay.
So this is about medication. Blood tests, usually there's routine blood tests, whole blood count, complete blood count, some biochemics, biochemic testing, and for the blood thinning. So these are mains. Electrocardiogram or ACG, it's also all mandatory.
So it's done like a week prior to the surgery?
Up to 10 days.
Up to 10 days.
Yeah, usually we say it's 10 days before or it's the same day that you come in. But again, if you do not have any underlying serious diseases, usually blood and other tests are good. So it can be taken even, well, 2 to 3 days before the surgery.
Okay.
Another important thing, these are the x-rays. For example, if we have x-rays before the surgery, so we can plan it. So if the patient comes without an x-rays, of course, we do them here. We try to, well, to standardize it and to plan the surgery. But it's better, for example, for me to have it in a week's notice and so on, so I can do the planning without any stresses and to see the backup plans and so on. So this is the testing. About adjustments at home, well, there are a couple of things, depending on the, again, surgical approach which would be used. But for instance, in the posterior approach, we recommend not to bend the knee upwards, bend the hip more than 90 degrees for 6 weeks. So we have to have these sitting, well, heights that would not exceed this angle of degree. But usually standard chairs, beds, and so on are fine. Talking about other stuff, these are the, for example, carpets that if they have their edges upward curled, so try to avoid those, because if you walk you can trip on it and fall. So try to take into account also and try to remove them or just try to make them straight, that you won't be, well, endangered in yourself. And other things, well, you know your home, so you know every bit of it, so it's much easier to navigate at home than at a nursing facility or in the hospital, because it's new to you. And the home, it's, well, it's all to you, you know every inch of it, so it usually does not make any problems.